Hello, I'm Sandy Clark, the School Health Nurse Consultant at the Kentucky Department of Public Health. Today we're going to talk about coordinated school health and school nursing services. What is coordinated school health? Coordinated school health helps school leaders coordinate efforts for student health and education and well-being while at school. It's comprised of 8 components. It consists of school health services, school nutrition services, school family community participation, physical education, school behavioral health services, a healthy school environment, staff wellness, and comprehensive school health education. Members of the coordinated school health team consist of the school district health coordinator, the school nurse, health education or PE teachers, the school food service director, the FRISCI, the Family Resource Youth Service Center director, or other interested parties such as community leaders, and it may include local health department staff. The school nurse role in coordinated school health is that he's an integral member of the coordinated school health model. They act as a leader that use professional education and skills that assist schools and community in the development, implementation, and evaluation of the coordinated school health model. The school nurse provides leadership, and they serve a supporting role in any of the 8 components. Now, in health services, you deal with management of acute and chronic health conditions, and you make referrals and emergency care interventions. In health education, you can provide classroom education, instruction that promotes healthy lifestyle choices. And then you can also assist in staff wellness and health promotion. You work collaboratively with the coordinated school health team that provide health information as necessary. And then there's counseling, psychological, and social services. You collaborate with others that identify students with psychosocial problems, intervention, and any referral that may be necessary for these students. In school nutrition services, you can help. The school nurse can assist in providing education on nutritious foods and snacks. You can do classroom instruction. You can provide information on students with anaphylaxis and food allergies that promote students' safety and wellness in the school system. And then with physical education, you can collaborate to provide information that's designed for physical activity. You can provide lifelong activity for all students. And one of the things, I do have past experience as a school nurse, and one of the things I did in one of my elementary schools, we had a population of 5 children who had a problem with being overweight, and I worked with the PE teacher, and we actually collaborated with a local restaurant, and so we went in and we designed, and we got parents' permission, and we set up activities, we set up nutrition classes, and we got one of our local restaurants, after we finished this end of this 2 months, they did a free healthy lunch for all of our students, so we took them there by bus. So this was it was a very initiative, it was a very learning time. We invited the parents to come along with us, so it's not only was the school, the PE teacher, myself as the school nurse, but it was also with our community that we got involved and began those partnerships. Now, with a healthy school environment, some of the things you might be involved with, you might monitor, may do reporting and intervening to correct hazards that may be in your school setting. And you will collaborate to develop a crisis intervention plan and for students with special health care needs in your school setting. How are these children going to be able to adapt to the environment? And then there becomes family and community involvement. The school nurse can help identify and provide programs to meet the physical and mental health needs of the students and their families in the school setting. You can assist to strengthen and collaboration among agencies and stakeholders in your community and in the school setting. And then there comes school wellness. Local policies are designed to promote students' health and reduce childhood obesity. Each local educational agency that participates in the National School Lunch Program or Child Nutrition Programs is required by federal law to establish a local school wellness policy, and this federal law was passed in 2004. Policies that might need to be addressed include nutrition education, physical activity of the students, and then nutrition standards for all foods available during the day at school. Some of the things that have changed over the last few years is they're changing what's put in vending machines at the schools as far as soft drinks and snacks, and foods that are even available as optional, that students may purchase optional, and also the staff and school employees may purchase during the school day. Policy components. You want goals set for nutrition education, physical activity, and other wellness activities for the school. You want guidelines for food and beverages that are made available during the school day, and this gets back to related to maybe you need to set up policies on changing on what you do offer in the vending machines available at schools, and even after vending machines, or what foods are sold at after-school activities such as sporting events. And then you need guidelines set for activities that promote wellness within the school and outside the school setting. And then there needs to be planning for implementation of these guidelines. How are we going to, once you set these guidelines, how are you going to implement this plan? How are you going to make these changes? And then you need to be sure and involve parents, your student bodies, representatives of nutrition program, school and public in development of the policies. Get your community involved. Now, recently we found out the CDC is looking at changing the coordinated school health model. They're still, when they set this up and began, it was in 1987 with the 8 components. But now they're finding that research that there's shows a link between health outcomes of young people and their academic success. So CDC is changing their outlook, and they're going to the whole child framework. So you're going to be seeing more of this. We just recently became aware of this, that Centers for Disease Control, CDC, and ASCD, the Association for Supervision of Curriculum Development, have developed this expanded model. So they're wanting to look at the whole school, at the whole child or student, and the whole community. They want to expand on our 8 components or 8 elements for the school system. So they want to move ahead with this. They want to make not only our children healthier, but our schools healthier and our school staff and employees healthier. So you'll be learning more about this. Information can be found on the CDC website, and this is occurring across the nation. For more information at the Department of Education, you can contact Jamie Sparks, who's the Project Director of Coordinated School Health. I've given you his, included his email address and the website. And then once again, I've included my contact information at the Department of Public Health, and Karen Irwin, who's a school health nurse consultant at the Department of Education. I've also included her email. Feel free to email us with any questions or concerns you have. This is what we're here for. This will be a learning year for you as you start your career as a school nurse. So we want to, we make ourselves available, and we are glad to help anytime we can. Thank you today for listening to our segment on coordinated school health and school nursing services. Have a good day.